We were
Hello,
just giving,
morning.
thanks, Shayla. We
We've
were
got a
giving
couple
fun.
folks that we're still trying to get the link for the transition, so there might be a couple more streaming in.
Got it. Got it. Yeah. We're gonna keep an extra eye on the waiting room because we were trying to give it a couple extra minutes. Usually we start right on time, but we gave it a couple extra minutes and we'll keep an eye on the waiting room if that sounds good. Because we knew had some extra folks coming on, and it sounds like you had a great meeting, Alicia. So, thank you everyone for joining us for more content. Um, I'm Liz Flannery. I'm the Director of Education and Leadership here at the American Institute of Dental Public Health, and we're thrilled to be here with you today to talk about veteran oral health in Kentucky. So, without further ado, I'm going to go ahead and get us started. So today I'm going to start with a brief introduction of who we are as AIDPH, why we're doing this work, give us a national overview of veteran oral health, and then dive into veteran oral health in Kentucky and look at your data sheet and what's going on in your state. We have discussion on here. We have designed these sessions to be as interactive as possible. We really want to hear from you, the stakeholders in your state, about if the data is representing what you're seeing in your work, what additional resources you need, any solutions or feedback you have. So we have several points woven throughout for you to engage. We hope you take advantage of those, and please pipe up. We'll do Q&A at the end, but please feel free to pipe up with questions in the chat as they occur to you, and we'll make sure to get to those. Some housekeeping pieces. We are recording this session. This recording will be available afterwards. So if you have colleagues or peers that you think are interested in this content, we will have it available for review afterwards. We will also post the slides and other resources. We invite you to share your email, your organization in the chat, introduce yourself with your name. I mentioned that we want these to be interactive and we want to hear from you. We also want to make sure that we create space for you to connect with each other as peers, colleagues, current co-stakeholders in veteran oral health in your state. We found that people have found a lot of success of sharing the programs that they're doing and making connections with people who can amplify that work or share it out. So please feel free to use the chat to that end to make those connections. I am joined by Shayla Stewart here from AIDPH, as well as Christine Coffey, who is our Director of Communications. If you have any questions or issues with Zoom, you're welcome to post those in the chat or message Christine or Shayla directly. So one of the tools that we're going to use for engagement is Slido.com. If you have not used Slido before, it's very easy to use. You can grab your phone and scan this QR code. You can open up a browser on your computer and go to Slido.com and type in this reference number here, and it will pull you to our questions throughout. Once you pull this up, I encourage you to keep it up because we have several opportunities to answer questions, answer polls, as we go out throughout our session today. So we have this up on the screen now, and we're going to pop the website and the reference number in the chat as well, so you can go back and reference that if you need to reopen it. These are our learning objectives for our session here today. This is tied to our CEU that is available with this session, and we will give more information on accessing your CEU at the end of this seminar. Okay, so let's get warmed up with Slido. So toggle over to that website that we just had. Again, it's in the chat if you didn't open it before. I'm gonna click it here. You can scan the QR code or plug this in. And we want to hear from you get started. What brought you to today's session? Was it to learn, to share, to connect, or act, or maybe it's all four of those? I love that I'm seeing 71% at all of the above. That's really fantastic. And learning. I hope you come away feeling like you've learned something new or learned a new way to activate maybe on information that you already knew. You'll have to let me know at the end of the session. Okay, this is great. I see that we're really engaging. Okay. I'm going to toggle us back over to the slides, but if you have not had a chance to answer this poll yet, please go ahead and continue to do so. We will keep it open even as I'm going through our slides. I am our presenter for today's seminar, and I do not have any disclosures or conflicts of interest to share. I went ahead and introduced myself at the beginning of the call, but again, I'm the Director of Education and Leadership here at AIDPH. I'm joined by Shayla Stewart, who is our Education and Leadership Specialist. And we just want to say a thank you to Alicia at Kentucky Youth Advocates for helping us coordinate this, invite all of you, make sure that you knew that this session was happening, and getting a robust group of stakeholders here. Alicia, it's been a pleasure to work with you. I had the pleasure of meeting Alicia in person earlier this year in DC at Hill Day with Open. I'm so thrilled that we get to join you in this virtual way as well throughout the year.
Yeah, we're so happy to have you guys here. Thanks.
Thank you. Okay, we're going to go back to Slido again. As we're getting started, we want to know what you believe are the top priority areas for veteran oral health in your state. And this will really help us tailor our content as we look at your state and what the data is saying there today. So I'll click us back over. We can see we have access to care, oral health literacy, workforce development, policy advocacy. My screen is getting a little blocked, but you'll be able to see those other options. Integration with general health care. And again, if you haven't opened Slido yet, you can scan this QR code or plug in the website here. So access to care at 83%. I can share that that's pretty consistent across the board. We have had the privilege of visiting over half of our states in the country at this point. Our goal is to get to all of the states. And I don't think we've had a single state where access to care hasn't been the number one on this poll. And integration, we're going to talk about why integrated care is so important and what could happen if we had a true integrated care system. So that's great. Okay, again, if you had not had a chance to answer, please go ahead and do so, even though I'm back on slides. So as we get started, I'm just going to share a little bit about who we are. You may be familiar with AIDPH, but if you're not, our mission is to empower our community to advance oral health through science, education, and advocacy. Our community is you, folks who are in public health, dental public health, working at the state and local levels to do this work and advance oral health. And I think that you will see how science, education, and advocacy come together through our work in our session here today. We're going to talk about all three. We do this work because we have a vision of a justice-oriented oral health system, and we want to move in that direction and help our community to do so as well. We have 4 communities of focus here at AIDPH. It includes LGBTQIA+ people, veterans, people with disabilities, and people living in rural communities. Understanding, of course, that there is intersectionality on these 4 communities of focus. For example, what we're talking about here today, approximately 30% of veterans report having a disability. Approximately 25% of veterans live in rural areas, and that's something we're going to talk more about as we dive into the data and look at the disparities that veterans can face in accessing oral health care. And of course, all of our communities have the common experience of historical exclusion and marginalization from healthcare systems. We want to take a minute and say thank you to CareQuest Institute for Oral Health. They are our funder for this program, and share a little bit about the work that we have done in partnership with CareQuest, particular to veteran oral health over many years. This really shows you the span of work that we have done in veteran oral health, starting at that national level, and then really hearing that folks wanted to understand in a more detailed manner what was happening at their states. We took that directive and developed out the state profiles that we're here talking about today. And along the way, we've had the privilege of taking this data and sharing data-informed policy options through several different advocacy opportunities and Hill Days. Okay, so what does veteran oral health look like at the national level? This might be familiar to some of you, but we found that many people aren't really fully aware of how VA medical and dental benefits actually work. And that's why we would just like to start by setting the stage with a clear picture of what's currently available through the VA. and what veteran oral health looks like at the national level before we dive into the state. So the key point, there's two key points I'm going to share on the next two slides. The first one is that eligibility for medical and dental care through the VA is not set by the VA. It's determined by Congress through a federal law called Title 38. And that law outlines what care is covered, who qualifies, how much it costs, and where it can be delivered. And because of that, any major change, like expanding dental coverage, requires congressional action. So it's not just a policy update or a rule change, it involves passing new legislation and securing federal funding to support that legislation. So when we talk about limitations in access to dental care for veterans through the VA, it all ties back to laws at the federal level. However, I want to point out that that doesn't mean we can't take action to impact change at the local and state levels. We're going to share some really successful examples of that. To do that, it takes getting educated like we're doing here today. So congratulations to everyone for being here and taking that first step. And collaboration with our local communities, which is why we're really striving to provide that stakeholder engagement and connection opportunity for all of you. Okay. So the second point, we understand that the eligibility process is set through Congress. The second point that I want to make is that currently most veterans are not eligible for dental care through the VA. And that's really surprising to a lot of folks. We find that over and over doing this work. So if you look at this graphic here, that top row of people you see represents all 18 million veterans living in the US today. The lighter colored half to the right shows that veterans who either receive care outside of the VA or aren't eligible for VA at all. And then as you move to the left and the blue gets darker, that represents the nearly 9 million veterans enrolled in VA healthcare. And of those, only a tiny fraction, the small dark blue and red segment, is actually eligible for dental care through the VA. So what that means in practice is veterans might go to the VA for a medical appointment, get treatment for chronic conditions, but are still leaving with untreated dental pain because they're not eligible for that dental care. And then the other point here is even among the about 1.8 million veterans who are eligible for dental benefits, only a third of those are actually using the dental benefits. And we need some more information there, some deeper understanding and access to data to understand that utilization rates. But we suspect that barriers to care and lack of awareness play a big role in that low utilization rate. So we're left with a really inequitable system. Veterans either aren't eligible at all or they face a fragmented oral health landscape that makes it hard to get consistent, high quality care. We know that that problem can be even worse for veterans living with chronic conditions. We talked about that integrated care piece at the beginning that was reflected in the survey. So we're going to look at some chronic disease pieces and how that ties into the integrated care piece. So veterans living with chronic conditions like heart disease and diabetes are especially vulnerable to oral health issues. And what's even more concerning is that veterans with those high risk, high cost conditions are more likely to lose all of their permanent teeth. And we see poor oral health outcomes for veterans than non-veterans, even if they've seen a dentist in the past year. So that tells us that access alone isn't solving the problem. Even when the veterans are getting dental care, many still face some of the worst oral health outcomes. And a big reason for that is the lack of the integrated care. Those chronic conditions aren't being addressed in coordination with other health needs. And that's why issue is really frustrating. VA is the largest integrated healthcare system in the country. It's uniquely positioned to manage complex care for veterans with multiple chronic conditions. But since most veterans aren't eligible for dental care through the VA, they're missing out on that critical coordinated care piece, which leaves major gaps in the overall health outcomes. So dialing into that a little bit more, this is research that we conducted in partnership with CareQuest that really focuses on the connection between chronic disease and oral health. So even after controlling for factors like income, education, and whether someone lives in a rural area, we found that veterans with diabetes were still 40% more likely to be edentulous, meaning they've lost all of their natural teeth, compared to veterans without diabetes. And that's a really powerful indicator of just how strongly chronic disease can impact oral health outcomes, even when other risk factors are taken into account. So, just as concerning are the findings related to heart disease. Veterans with heart disease were 30% more likely to be completely edentulous compared to veterans without heart disease. And that reinforces what we're seeing across the board. Chronic conditions like heart disease and diabetes have a significant impact on oral health outcomes for veterans, even beyond other contributing factors. So let's talk about this at a systems level. What we really want to highlight here is that it's not just about poor oral health outcomes or reduced quality of life. Of course, those are very serious concerns, but it's also about the broader health impact and the cost of care. When dental care is managed as a part of an integrated healthcare system, like what the VA could offer if dental coverage were expanded, there's a clear opportunity for cost savings, especially for veterans with chronic conditions. So some of our recent research shows that for every $1 invested in dental care as part of diabetes management, there's a $1 savings in related medical costs. And with heart disease, it's even more striking. For every $1 spent on preventative oral health care, it can result in $2 saved in heart disease management. So at that point, dental care isn't just a health benefit, it's paying for itself in that healthcare system. So I just want to put a pin in this and say, keep this in mind. It's really important context to have when we look at chronic disease trends in Kentucky and consider what solutions might look like in your state when we get into your state data in just a minute. Okay, these are some additional data points that we collected through research in partnership with CareQuest. We pulled data from Burfus, which is a national survey of veterans administered. This one was in 2021, as well as data access through the VA, and really looking at some pieces for rural versus urban veterans and kind of understanding what that looks like. The other piece I want to highlight here is that data gives us good information and gives us a strong point for offering data-informed solutions that we know are solid. But it's not just about the data. It's really important to share the stories behind the data. And we always try to approach our research in a mixed methods methodology so that we can highlight what that impact is in a first person way. So this quote you're seeing here is from some of that research. It's from a working age veteran in Maryland who is just unable to afford care and is asking for help. And I think it's a really stark understanding of the impact of the data that we were just looking in a first person way. Okay. We can pop in the chat here, vetdentaldata.org. So all of the research I have talked about so far and the research that we're going to talk about from here on out to include your state profile is available on vetdentaldata.org. That is our compendium of information on veteran oral health. And I just want to take a second and highlight here that in addition to the publications that we have on there, we have several interactive dashboards that you are able to use to pull up and really kind of dial into the data based on your needs, your work, your state. So this here shows more interactive insights on rural veterans, cost of care, state-based indicators that can be accessed. We have an entire tab dedicated to rural veterans. We talked about the fact that veterans disproportionately live in rural areas. And I want to point out that while the data aren't available from MEPS, which is Medical Expenditure Panel Survey on a state level, they can be evaluated by region. So you can get a sort of a proxy for state level data here. Another screenshot here, when you click on the rural tab, it will take you to the interactive dashboard on rural veterans. And you'll see across each indicator, it's clear to see that rural veterans delay dental care due to cost. They spend more out of pocket on dental care, and they struggle to find accessible locations for dental care. Okay. This is another screenshot that you can get to and dial in. You'll see that rural veterans also feel more impact from lack of access and utilization of dental care, often citing that the state of their mouth or teeth is embarrassing, referencing that quote that we just shared. um, compared to non-rural veterans. So rural veterans also struggle more with a functional dentition, which likely leads to the data points we see around increased cost of care and higher emergency department use. So this is just highlighting the publications that we have here on vet dental data, and this is really just a snapshot of the research and tools we've developed to help folks who are doing the work at the local and state level. The data can be really hard, tough to find, and that's why we've worked closely with CareQuest, veteran partners, and pulled every available data point we could from the VA, from national surveillance systems, and more, and brought it all together in one place to make it easier for you to use and apply the information in this work. I will also note that we view this website as a dynamic place for work on veteran oral health. So if you are working in the veteran oral health space and have research or work that you want to share, please reach out to us. We're happy to feature the work on the site. Okay. So we are going to, in just a moment here, dive into your state and look at things. Um, So I want to share that you can pull up, if you're go to vetdentaldata.org, if you haven't already looked at your profile, you can go to the website now, pull up your profile. We would love for you to follow along as we go through it. You can go to publications and click Kentucky. You can hover over Kentucky on the interactive map. You'll find a detailed profile, and we invite you to do so now. Before we do that, we are going to go back to Slido one more time, and we would love for you to share one word naming what you think your state's biggest challenge is for veteran oral health before we really dive in. I think I'm seeing reflected what we started out with that access to care piece. Um, and if folks have other thoughts, I'd love for you to chime in the chat, but the coverage, the cost, the affordability, those all tie into the access for me. Chronic conditions. That would be great. We'll be able to see what the specific breakdown of chronic conditions in your state and the grading there. Okay. All right. So again, I see not everyone has responded, so I'm going to toggle us back to our slides. But if you haven't had a chance to respond to this with your one word, I encourage you to continue to do so even as I go back to slides. Okay. So what does oral health look like in Kentucky? So as I said, we put these state profiles together to answer the frequent question we were getting, which was, what does veteran oral health look like in my state? And we put together this road tour after developing those profiles to ensure that folks understood that these resources were available, but also this session is just as much about listening and learning from you. You know Kentucky best, your data, your context, your communities, your insights help us improve these profiles and make sure the tools that we're providing are actually useful in your efforts to support veteran oral health. We've done our best with the data available, and while it's limited, these profiles aim to offer clear, visual, easy to use information that can support conversations and decisions across different audiences. They're really made for you to be able to use with lay people. Okay, so let's dive in and start at the top of the state profile. We've opened each profile with this quick context, what's happening in Kentucky and how it fits into the bigger picture nationally, especially when it comes to dental care access through the VA. So just like we started this seminar, we start with that key point that most veterans are not eligible for dental care through the VA. It's something that many people, especially policymakers, funders, decision makers, don't realize. So when you're starting that conversation, it's a really powerful place to begin. veterans often don't have another option for dental care. And because of that gap at the federal level, it's the states and local healthcare systems that end up carrying the weight, whether it's disease burden, access issues, or care delivery challenges. We've also included data on where veterans live across Kentucky, especially counties with high concentrations, and we pulled in whatever we could find on rural veterans. Veterans are more likely to live in rural areas, and as we know, rural communities already face higher barriers to care and worse health outcomes overall. So, right up front, we hope this gives you useful county level insight to support better informed local decisions about how to deliver care and improve access. So you can kind of see the 3 highest counties down here in the green, and also use this map up here to get a full state overview. So taking a look at some specific state-specific insights. So here we're comparing Kentucky to national averages because without that context, the numbers don't mean much, right? So if you're sharing this with a policymaker, a program leader, they might not know if 10% is high, low, somewhere in between. And that's why we've included the national averages to help you quickly see where Kentucky stands nationally, and then you can also take this and compare across states if that's helpful. So some states might have similar challenges, they might have similar demographics, and as someone working in Kentucky, you probably know which comparisons make the most sense to pull up those state profiles and look at the comparative numbers. All 50 state profiles are available on our website, so you can pull those up. I will also share a screenshot in a minute about how you can toggle over the interactive map for a faster comparison. So we just talked about chronic disease, and that was also mentioned in the feedback you shared in the polls and the word cloud. Those high cost, high risk conditions like heart disease and diabetes that are closely connected to oral health. And because those connections came through strongly in our research, we wanted to make it easy for you to highlight them when you're talking to decision makers or planning programs. So in this section, you'll find data on heart disease, diabetes, insurance status, and indentualism, all compared to those national figures. And then we've also ranked each state across these 4 outcomes. So you'll see where Kentucky falls compared to all 50 states. Um, and looking at this, you will see that number 1 is the worst. So the higher, the better as you go across those. If you're interested in the rankings, the technical details of this research, that's all also available in the methodology section of vetdentaldata.org. Okay. And then this is where we get to the grade portion of the profiles. We chose a report card format because we felt like it was really an easy, fast reference point. Everyone has received most people have received a report card in their lifetimes, and it's a really quick way to kind of understand where folks stand. So we see the grades individually given for diabetes, rates of uninsured and dental visits, the percentage of veterans in Kentucky that visited a dentist in the past year, and those combined for an overall grade. And what I want to point out in this portion is to encourage you to not only look at the areas where you have a lower grade and is an obvious call for improvement, but to look at the areas with higher grades as well. You have a good span here, right? So taking a look at and seeing where your state is succeeding and exploring why and how you got there, that aspect of veteran oral health care can give us a lot of insight to a path forward for the areas where we need to improve. We can take strategies that led to success in one area and potentially apply those strategies to the next area for improvement. Additionally, you can use the same tactic when looking at other states. We talked about that comparison piece. So looking at your neighbors or states who might have a similar environment, whether that be veteran population numbers, government structure, healthcare infrastructure, it can be a helpful tool in finding successful models and strategies to pursue. To that end, I will also highlight that we mentioned it's incredibly important to hear from you. We are working to produce a compendium report from these seminars that will include summaries of participant feedback and programs in their states. that we will be publishing later this year and continuing on throughout these seminars. We often hear from folks, what are other states doing that is successful? So we're working hard to gather all that information, share that out for successful models. So I mentioned that I would share this screenshot. This is a screenshot from Vet Dental Data where you can quickly go to this map, hover over the state that you think might be helpful to look at, and quickly see their information. And if that's useful for you, then you can dive into their state profile a bit more. Okay. So now that we've gone over that information, that is what the data is showing us. And we want to hear from you, understanding that the data can be limited. What is one barrier that isn't in the data, but you know is real for veterans in your community? So is there something that you are seeing in your work that isn't reflected in the areas we just covered? And I would love for you to put it in the chat. Shayla, I'll ping you to call out um, since I don't have as good visibility. I will also note it can be something that you think you suggest that we need to look into more, that we need to find a way to gather data on. If there's something to that end that you're seeing in your community, we would love to hear that too. Okay, I'm going to click through, and Shayla, I know you'll interrupt me as things come through.
We just had one response. Alicia,
great.
she says that she found in planning for this session that there may be a lack of awareness of the population needs in general.
Okay, that's really great to know. We're going to talk a little bit about that, about how folks can use the information that they learn here today to amplify the need and start the conversation in your state. That's a really good place to start. Similarly, something we often hear is, we broadly don't have good information on where veterans are getting care. So that's another, a similar or a tangential piece of missing data that states often have a conversation about. And it might be a conversation of, can we change our intake forms? Can we change our surveillance system? So we start with an understanding if folks are serving veterans. There is often clinicians and providers who are likely serving veterans and don't know that they are.
Liz, Laura also stated that coordination with local healthcare to connect to the dental care is a challenge.
Okay, really great. And if folks want to share if there are systems or positions in place in your state for that care coordination piece, or if that's where we need to start, it might be that those positions need to be created. And sometimes it's an education piece. Maybe there are care coordinators, but we need to pull together information so that those care coordinators understand the options available. That's another piece we see come up. Okay. I will keep going, and Shayla, please interrupt as we go. Thank you, everyone who has shared so far. So we said we were going to talk about how to use this information and how to address some of the issues that you just brought up. I hope that the details we just gave was informative. What we really want you to take away from this session is next steps and how you can leverage this as a tool in your work. Alicia brought up kind of understanding that this is a population need. So we're going to talk through about how we can focus on that a little bit and address that. We want to talk about how you can use the data to illustrate the need. Share the profile to start conversations, and then take action and elevate success stories. So let's dive into that a little bit more. One of the most powerful things we can do with this data is to advocate. And that can look different depending on your role. And also there's big advocacy and little advocacy, right? It doesn't mean one is more important, but I think often when people hear advocacy, they think legislative advocacy. We're changing to we're working to change a law or implement a new law, but there's a lot of smaller advocacy pieces we can do along the way. This profile, we hope, gives you credible local data to bring to maybe it's your city council, your congressional reps, or maybe it's another colleague or another organization. Again, to that point of sharing out that this is a population in need in your state. That sounds like, based on Alicia's feedback, the first place to start with advocacy in this topic. You could do something like organize a listening session in your community. You could invite decision makers. You could invite veterans themselves, again, to hear that first person account. And just noting that smaller advocacy actions, they can really have a ripple outward in big ways. So when we say kind of big P, little p advocacy pieces, it doesn't mean one is more important than the other. Educating to empower. So again, many people working in healthcare or veteran services don't know how stark the oral health gap is, and that's where the education piece comes in. So you can use this profile to lead a short talk at your organization's staff meeting. Again, sharing out sounds to me like the number one piece you could start with. You could brief a coalition or a partner organization. You can share out the recording. You don't even have to lead the talk with the profile. You can share out this pre-prepared talk, and that's a great way to start. We really find that when stakeholders are informed, they become allies, and that's how we start building momentum on a piece that needs work. So it's really an opportunity to collaborate across silos. So maybe you bring this to someone in housing or transportation, maybe it's mental health or food access, and find a new way to align your efforts. Those non-traditional partnerships can really be a big piece in making these public health impacts. Okay. We also hope that this data is a tool for strategic thinking. So whether you're leading a nonprofit, managing a health program, advising on policy, you can use this profile to decide where to focus. And that might be literally where, so looking at that map and those counties of where veterans are most concentrated, or it might be an area, right? Maybe you're looking at diabetes as an area as the where. It also helps you make the case for why. So do we need to invest resources here? And if you're doing evaluation or reporting, this gives you a baseline to start with of here's where we started and here's where we're trying to shift to. So looking at that a little bit more about how this profile can bring in resources. Grant makers and funders want to see data and they want to see it grounded in the community, and this profile gives you that local base. So you can use it in the problem statement of your grant or to show gaps in care. You can also cite it as a foundation for what your solution will address. And again, as a benchmark, if you're measuring outcomes and deliverables for a program, you can use this data as a benchmark of where you started. Okay, I'm going to pause for a second and see if there's any questions that I can answer.
Liz, we did have a few more responses in the chat. Jennifer stated that the silos between VA dentistry and the rest of the safety net dental community. And then Amanda also highlighted that the mental health needs of veterans and how dental providers can provide the best care in these situations.
Those are really great. So something that has come up in these seminars in several other states is that mental health piece, and particularly connected to trauma-informed care. Conversations around, are there ways that we can pull in trauma-informed care trainings for clinicians? Is there a way we can pull that into curriculum? Or even just promote it of, Sheila, I know you might, I don't want to put you on the spot, but I know that you've found access to trauma-informed care trainings through other organizations. I don't know if you want to speak to that a little bit.
Yeah, I volunteered and actually worked with the YWCA Dayton in my area a little bit, and they provided the training. And so that's where I personally received it. But so many nonprofits do. Like there's an organization, and of course I'm speaking from Ohio, like Women Helping Women, and just different organizations that will offer that. You don't have to necessarily have a certain title, or you can find open courses that I just decided to take, and it was very informative, and it definitely made me a better dental clinician because I'm also a hygienist. So it helped me so much in the operatory as well.
That's great. Thank you. Um, yeah, so really that kind of non-traditional partnership piece can really play a part. So I wonder, maybe there's organizations in your state that might already have trainings put together that could be leveraged in another way or offered to clinicians. Um, I'm also wondering this silo piece. So Jennifer, if you wanted to come off mute, I would love it. Or if you just want to put in the chat more, the silos between VA dentistry and the rest of the safety net dental community. Um, I would love to hear more about that and if there are ways to overcome those silos.
So my experience was working as the dental director for an FQHC, just trying to find care for veterans. And, as you mentioned earlier, not all of them have that dental benefit through veterans. And so, I remember trying to figure out referrals or even how to contact, the VA. We have a VA clinic in Louisville where I was working at the time, and it was just really difficult to try to get in touch with them, to see, for example, how to check and see if this patient had the benefit and should they be accessing care there rather than coming to our FQHC. We want people to maximize whatever benefits they have so it can be affordable for them. And they were, working off of our sliding fee at the FQHC. So yeah, just how to better communicate across those types of organizations and how to better serve those patients so they're getting access in the best venue for them.
Yeah, that's really great. And I think, I was if folks have thoughts here, I would love to hear from others and in your state specifically. But I think well, first of all, that's something that we also hear often doing this work, kind of state-based and nationally. And I think that communication piece, or overcoming the red tape piece in some ways can be something that we can that is something that could be changed without legislation in some scenarios. So if there is a way to get in touch with folks at the VA administrators there through coalition work, through advocacy work, sometimes it might be more of one of those places where it's more of a policy or a rule change or opening a channels of communication that can impact that versus having to change things at the legislative level. And something that we talk about too, folks always say, if you've been to one VA, you've been to one VA. So I certainly don't, they are the opposite of a monolith. They are very different, place by place. So recognizing that, and I certainly am not an expert in the VA or your local ones, but in conversations with folks who work at the VA at the national level and in different state-based places, um, as well as clinicians who are providing community care, they want to serve veterans, and it's overcoming that red tape piece that you just illustrated so well, Jennifer. Um, so I think it's really making those local connections. Maybe it's an educational campaign. Maybe it's the coalition working to connect and finding ways to overcome or change rules at the local VA or policies pieces. Um, so that's not a full answer, but maybe an approach that would be helpful and more achievable than changing things at the legislative level. Are there other questions that folks have that we can answer? Oh, Pam, you have your hand raised. Yes.
I do have a question. I am a faculty member at the UK College of Dentistry, and I
Mhm.
know that we have a dental student group that is dedicated to oral health for veterans. And I wonder if what I suspect is that there are other chapters of the
Mhm.
of the VA Dental Society in that for the dental students throughout the United States, and I just wondered if your organization works with them to provide resources for them that they might share with the broader dental student community.
Yeah, that's a really great question. And something that we find, so I have a yes and no answer for you. Something that we find across this work is that there are often many, um, it might be nonprofit organizations, it might be school-based organizations who are providing pro bono work or sliding scale opportunities for veterans to get health care. And a challenge there is making sure that the veterans understand that care is there. Maybe those organizations aren't set up to service all veterans or provide a permanent dental home, right? But there's other organizations in the state, but they're small or they're siloed. And so, how do we connect those pieces? One piece that we're working on, that's one we would love for you to share that information, your local chapter, if you're able to pop it in the chat or send it to Shayla or myself afterwards, we'd love to share it with this session materials. And two, when I referenced vetdentaldata.org as a compendium of work, our next step process with that is we really want to provide a directory of those state options for care. We find that we often get emails, while we don't provide direct service, we often get emails from veterans saying, how do we find care in my local area? And because we have the opportunity to have these conversations with states and get insight into those care opportunities, we're working to pull together those organizations that are at that local level, to provide a directory that veterans can go in and put in their location and find what options are available to them. And so I would love to hear what you have going on and be able to pull that into our information.
I'll try to find out
Okay.
more about the student organization and get that information to you via email. I don't think they're providing any care. I think it's just more, I was thinking it would be more about that organization just building awareness among their fellow classmates and providing that website that you've shared with us today, and just kind of talking about what's going on in Kentucky.
Yeah, yeah, that's really great. The awareness piece is incredibly important. And not to kind of cross streams too much and go off on a tangent, but another program that we run is our pre-doctoral hub on our academy, which is pulling together resources for really to work on that workforce pipeline that you're mentioning, Pam, and ensuring that students understand the needs of certain populations and underserved communities. We would love for more folks to make the choice to go into dental public health specialties, but also even for folks who don't, even if they're going into private practice, having kind of that public health foundation to their work. We reference kind of that mental health piece, that trauma informed piece. We really believe that pulling that in to folks' education the sooner the better, and really giving them that public health mindset, even if they don't end up with an MPH or a public health specialty, it can really impact their delivery of care. And we think that that's really important. So that's great. Are there other questions I can answer?
Hey Liz, I am not very well versed in like the VA benefits and kind of what that looks like, but I had a question about so I know there's like obviously VA centers and healthcare providers that are like VA owned and operated, but also states use community care networks, right, to like essentially allow community providers to provide VA benefits. Is that correct?
Yep.
And so I was just curious if you guys have any information on what that looks like in Kentucky. I don't know if that's something that's like easy to find as far as like what that network looks like and what types of services are being provided out in the communities. Or I guess, for instance, like are most of the dental services that are being offered through the VA like located at those hubs for like VA, centers, or are they out in the communities, or do we know?
That's a really good question. So a couple of pieces. I mentioned earlier, I think, kind of saying folks might be serving veterans and they don't know. We don't have the data on where veterans are getting care. So that's one piece. And we always encourage those conversations of what can we do with our surveillance systems or our current data gathering systems of how can we get that information? And that will give us a deeper understanding. So that's one recommendation we have for data gathering. The other piece, I would say the community care network, that is, and again, I am by no means an expert on kind of the intricacies of this, but very broadly, I will say, think of that much more as the way you would with an insurance company, you go to a doctor and you get a referral out to someone who's in network. So if someone's getting treated at the VA and they say, oh, you need this specialty care, you need this XYZ, but it's going to be a 4-month wait to get it at the VA. Then they go out to someone in the community care network and give a referral to get that care to someone who is in network with the insurance, right? So it's not centralized, like you're saying, like kind of here are these hubs of people, and you can't go you can't just go there instead of the VA. It's like a referral system when the care isn't available. And I'm saying the wait time, but there's other pieces, right? So that rurality piece is a really big part of it. So if folks aren't close enough to the VA and they can't get the care within a reasonable distance, that's another instance. But they need to kind of qualify that through different ways, wait time, distance, etc. And again, I'm certainly not an expert, so I'm sure that I'm leaving pieces of that out. It's more nuanced and complicated than that. So that was a long answer to say we don't have the information that you're looking for, but we would love to.
Yeah, that's helpful just to know kind of how that's laid out and what that system looks like. So thank you.
Yeah. And I think, Alicia, you're probably remembering that was one of our focus areas for Open Hill Day of strengthening the community care network. Part of that goes back to what we just talked about in this conversation and the siloed pieces between VA and the safety network. There's a lot of red tape, unfortunately. And so folks want to be in that community care network. They want to be serving veterans, but doing the paperwork to get approved and all that. We hear anecdotally that can be pretty arduous. And so that was a little bit what we were talking about with Hill Day of kind of how can we streamline the processes without changing the legislation? What can we do with rules and policy to make it easier to participate? As well as on the VA side. So VA clinicians are doing a lot of approval processes, spending a lot of time admin versus clinical, where there's some opportunities for streamlining those pieces.
Yeah, definitely. I'm sure that resonates with folks on the call and in Kentucky because I know similar challenges come up with like joining the Medicaid network, for instance, in Kentucky,
Yeah.
just like how challenging it can be on the provider admin side. So I imagine it's a very like mirrored thing in terms of like it's not necessarily that folks don't want to be providing that care. It's just that it's more difficult than it maybe needs to be to be kind of in those networks.
Yeah, 100%. Okay, we have just a few minutes, so I'm gonna pull us back to kind of our next steps. Thank you everyone for participating in a robust conversation. We're always here. If you have a question that didn't get answered, we're happy to follow up with those via email. And I'll see if I can pull my slides up real quick again. Okay. So we would love to hear from you one more time. If you're willing and able to go back to Slido before we leave each other. As I mentioned, we always want to ensure that we are making our work translational. We want to leverage our tools and our research to best serve you. That is what we do at our organization. So we would love to hear what additional tools would be most helpful. What else do you need in your work? I heard some missing data points, so that's great. We love to hear that and talk about how we can improve our data collection, educational materials, policy briefs, training modules. Okay, great. For those of you who selected education materials, if you're willing to pop in the chat, which audience members those education materials are for. We hear a lot of different things. That might be veterans themselves on oral health literacy. It might be those care coordinator pieces, understanding what resources are available. If you selected that and are willing to share, we'd love to hear that. Okay, we have just a minute, so I'm going to quickly toggle back to our next steps, but please continue to answer if you haven't done so yet. Okay. And I actually, I apologize. I'm going to click through these because we don't have time, but these will be on our slides. I mentioned state-based success stories, and these will be on our slides as states to look into who we feel have really strong examples of kind of out-of-the-box ideas of things that they've done at that state level to approach veteran oral health. And again, we're happy to have conversations offline about these more. I'm really clicking through a lot here. We're also highlighting over also on vetdentaldata.org. You can see the work that we have done in Iowa, which is a state where we have done a deep dive into veteran oral health. It's really a case study of what can happen in a state when you take a deeper look. We had the opportunity to do more in-depth research as well as community-based work and working with stakeholders to make a strategic plan, and are now at the point of moving forward with that. So that's some exciting work and exciting examples as well. Okay. I referenced this slightly, but we really hope that you're feeling activated. We know it's a lot of information to take in, but leaving you with one concrete, easy step to take, we would love if you could share out the profile with one new person or organization. If you're willing to post that in the chat, we would love you to hold each other accountable and keep your momentum going. If you need support on sharing that out, we are happy to help. Just let us know. CEUs are available. Shayla is going to pop the link in the chat. Those are hosted on our Academy. So the link here is going to pull you up to the main VRT page. I think you click on next. All of our VRTs are listed. So scroll down to Kentucky and that will give you the link to request your CEU and click through and be awarded that. I mentioned recordings and resources will be posted on the Academy today, so that will be available. Again, we will email out when those are posted and you can share forward with colleagues. We are also working to collect stories from veterans on their oral health experiences. That is incredibly helpful in our advocacy efforts. So we are going to share the link to our storytelling form in the chat here. If you yourself are a veteran and are willing to share, we would love for you to share. If you know a veteran and are willing to share that storytelling form out with them, we would so appreciate it. And we leave you with the fact that veterans deserve equitable oral health. And just thank you again for being activated, for sharing your time with us today. We're thrilled to talk to you and look forward to following up. Alicia, I will do a quick check. Do we need to pass? Do you guys have additional links or places to go, or is everyone all set? Good.
Nope, I think everyone is all set. Thanks for joining, everyone.
Yeah. Thank you so much. Have a great day, everyone.